Hello, everybody. Our first presentation today of the Silver Zone is Axel Vanderperre, who is a person living with HIV, a long-term survivor and founder of Utopia BXL, a patient organization focusing on HIV and aging, and coordinator of the Positive Council consultancy body to the Belgian HIV National Plan, and board member of Rainbow House, which is an LGBTQ plus organization in Brussels, Belgium. So I'm going to turn it over to you, Axel, who is there on our screen. And when you want me to advance the slide, Axel, just give me a shout.
Good. Well, hello, everybody. Welcome. I'm calling in from south of France, where I'm on holidays. But I was very happy to introduce those sessions of Silver Zone. I will start with maybe a dry subject, a survey, but I think the results from it are interesting, and those who are interested can contact me through the organization, through Kate, or through Realize, etc. The survey, in fact, is a first start to develop an education program for patients of persons living with HIV and focusing on the older 50 years and more. Thus, it's about the assessment of needs and expectations regarding the education of those persons living with HIV. Next slide, please. It has been possible thanks to an unrestricted grant from the pharma, Viv, Gilead, and MSD. Next slide, please. And thus, what is the purpose of this study? Is to, thus, what I said is the title, to identify the quantify the needs and expectations of those persons of aged 50 years and more, with a view to improve, develop, and implement a therapeutic, educational, and positive health program. In short, positive health, it means all subjects of health. There's not only the biomedical, but as well the social, the sexual, affective, and emotional health. And that you will see in the survey, all these elements have been interviewed. Thus, the method is with different sections. Thus, the organizations, the social, the emotional life of persons living with HIV, and social and professional life as well. Next slide, please. Thus, starting with the more biomedical. The first question is, how much do you know about HIV in your treatment? Thus, focusing on those persons of age 50 and more. Most of them think they know sufficiently or a lot, but when you ask how much information do you need, still a lot, more than nearly 60% say I need some information and I need a lot of information. Thus, it's not because you are older that you don't need more information. And you will see afterwards what kind of information those people want. Next slide, please. Thus, what is for you, those persons, the important HIV information you want to get? And what's in blue to facilitate, it's the most important ones. Then I summarize the survey, important or very important, and you see it's about preventing HIV transmission, how HIV affects my body, what can I do to stay healthy with HIV, getting older with HIV, and taking care of my mental and emotional. Next slide, please. And then the question that's formulated somewhat differently, what are the three most important topics? It's what can I do to stay healthy with HIV? A lot of persons are anxious about getting older and they want to stay healthy. That's an important message to the organizations, to the healthcare professionals. How HIV affects my body, the same area. Getting older with HIV, those are three topics which we can put together even, and preventing HIV transmission. Those are the most important ones. Next slide. When seeking HIV information, from whom or where do you prefer to get it? And you see, certainly in Belgium, that there's a lot of confidence towards the physicians, because 83% are saying from their side, and somewhat less from the HIV organizations, only 1/3. Next slide, please. Then some questions about the treatment itself, HIV treatment. How you experience, do you experience one or more undesirable effects? And 40% say yes. And when then the question is asked, have the healthcare professionals suggested any remedies to relieve those undesirable effects? Surprisingly, more than 1/3 say not really and not at all. Thus, there is really a gap between the amount of undesirable effects and the communication to the persons living with HIV. Next slide. Then about what are those undesirable effects? It's about fatigue, it is about libido, it's about trouble sleeping, fat distribution, muscle pain, neuropathic pain. For example, I'm suffering from neuropathic pain, and obviously this has a big impact on quality of life. And I think this is also underestimated also by the professionals. Then which undesirable effects of the medication were you told about? There you see again that there is a gap of communication, because only 30% did get some information about the fatigue problems, 50% only about loss of libido, etc. Muscle pain, 23%, neuropathic pain, only 60%. Thus, the message is undesirable effects, yes, but the communication about is not well done by the HIV reference centers. Then some questions about getting older. A fair amount, or a lot, or extremely are worried about getting older. Then when you ask, is growing older for you different than with the seronegative population? 49% are saying yes. And how aware are you about the progression of possible complications, comorbidities? A lot are not aware, as you can see here. Next slide. Then this is an important message. If you ask the question, how concerned are you, and you put the three topics, physical health, mental health, and sexual health, generally speaking, people are more concerned about their mental health and sexual health than compared to physical health. And when you see the numbers in blue, those are higher than physical health. For mental health, it's memory, concentration, depression, anxiety, insomnia, and sexual health, it's erectile dysfunction, loss of libido, and for the women, vaginal dryness. Next slide. Then questions, but a little bit formulated different. How would you rate your current physical health? If I take only in blue the poor, there's those who score poor, you see 5% for physical health. But when you look to mental health, it's more than double, 12%, and sexual health, much more, 24%. this is the same message. Mental health and sexual health are big problems and I think, communicated within the HIV reference centers. Yes. Then some question about the lifestyle. We're not going in detail due to timing, but generally a lot are adapting their lifestyle. There is only a small part smoking in Belgium, which may be different compared to other countries. Next slide. That we can skip. And then about the different substances, still nearly 10% are drinking alcohol every day, and knowing that alcohol is certainly not positive for HIV persons in general. 60% are smoking and are using also chemsex, drugs, and 8% would like to get help regarding this. Next slide. Then, which healthcare professional do you talk to about your HIV? And there again, you see that the hospital doctors has got the most confidence, and the general physician, again the physician, and less the nurses. There is work to do because nurses are there and are available. There is still a gap to fill. Next slide. Thus, to continue with the relationships with healthcare professionals, the question is how much attention was paid to the following aspects during your last consultation. And again, a lot, and we are not surprised, but the figures are there. There is much more attention to physical health, when you see a fair amount or a lot of attention, compared to mental health and sexual health. Thus, in generally speaking, again, mental health and sexual health should go much more in front, eventually in developing services with nurses or outside the hospital and so on. Thus, the model of HIV care should change in order to answer those gaps. Next slide. Do you have the impression that your opinion is taken into account in the medical decision-making regarding your treatment? And you see still that some say no, and still 17% say I leave it to the doctors to make the decisions, which is not, let's say, the way how to tackle your taking care of yourself. Next slide. Are the subjects other than your treatment that you would like to talk about? And the most important are in blue, the complications, the comorbidities, like before sexual health and sex life, your experience of the illness, and your mental health. Next slide. Do you talk to other professionals outside the hospital? And again, you see generally the general physician, but much less, and it's quite in contradiction. And you see that sexual health and mental health is an issue, but still there are only 70% and only 4% speaking with the psychologist or social worker. Thus, there are barriers to go to those professionals. Next slide. Then the third topic is emotional life. Among those people close to you, who is aware of your HIV status? And I put in blue, nobody knows about my HIV status. Those persons of 50 age and more, still 12% don't speak about to nobody. That's which is, I think, a big number, 12%. Do you receive support from your close friends and relatives? You see, again, it's more than 1/3 when you look to not at all and not really, who are not able to get support from their close environment. Next slide. Are you able to talk to those close to you about your HIV? And like before, never to nearly 50% to their family and 1/3 to their friends. Thus, we are not still there. HIV is still a stigma. And if you cannot speak with your close environment, I think this is really not positive. Have you ever been rejected in a relationship? Roughly 1/3 say occasionally or often. And nearly 60% have a partner at the moment of the survey. Next slide. How difficult is to tell about with your partner? 1/3 are saying that they have difficulties to talk about. There's still, I think, the HIV organizations have also a way to help HIV persons to better communicate or to get to decrease the barriers to talk about. Do you talk about the risk of HIV transmission with your partner? Still, there are not some not talking about. Next slide. Then continue about an emotional life. Are you satisfied with your current sex life? Not at all, 9%, not really 33%. Does it seem concordance with the previous slides about sexual health and sex life? Next slide. Next slide, please. Then do you think you have been discriminated? Well, next slide, please. If yes, there's discrimination, in which context have you experienced this discrimination? In seeking treatment and care, in your social life, in applying for insurance, and applying for a loan. Then under is the question about professional status. There's still a substantial number are working full-time or part-time. Yes. Next slide. Do you need help with topics? It's seeking treatment and care, in traveling and applying for insurance. And then the question, general question, do you think the general public is sufficient informed on the subject of HIV? Not at all, more than 1/3, and not really 42%. Because there again, there is still a gap after 40 years of HIV. Next slide. Do you know of any organization that offer help to HIV? Which is surprising, 21% do not know. Thus, HIV reference centers are not saying immediately what are the organizations, etc. Thus, there is also room of improvement. In order of time, I skip the other question. Next slide. Do you currently feel the need to visit an HIV organization? 1/3 say yes. And today, what are your main needs to make living with HIV easier? It's, like we said before, medical information on HIV, a friendly and welcoming place, information on existing support structures, psychological help, information on claiming benefits and compensation. Next slide. And what are the services you have used in last year? It's a hospital, which is logic, social security, and a local organization, only 8%. People living with HIV find it difficult to get help. Tell us if you have experienced any of the following problems. And the most important ones was you could reveal your HIV status with the appropriate help. You don't know where to find this help. Ask for help is too complicated or difficult, and you think that this help is not available near you. There's again some room of improvement there. Next slide. Then some topics about the population which answered. As you see, gay and lesbian was 57%, but still we have, and in Belgium, it's the percentage in general of the population, because it's in accordance with the population. We have people from Europe, and the survey was in Belgium, that's obviously Europe, but also Central Black Africa. We have quite a lot of people from this area in Belgium. And 31% were single. There's only 31%. Yes, next slide. Yeah, that's about the mode of HIV infection. And undetectable, yes, we have 95% are undetectable. That's a good score, but as you see, there are a lot of other aspects which didn't score well in this survey. Next slide. Then some about the level of education, the children, etc. And then how many years have you been living with HIV? As you see, it's not only long-term survivors, it's a little bit every person, late diagnosis or from 10 or 15 years ago, etc. But 1/3 were long-term survivors. Next slide. Thus, my conclusion would be the results suggest the need to improve patients' ability to express their needs. In addition, this survey helped to develop an education program, in fact, which we have developed now, focusing on the different topics of health, not only physical, but also social, mental health, and sexual and affective health. Another message I would put is it's not only about numbers, the 90-90-90, it's also about the hurt in the treatment and monitoring of HIV people, asking them questions and look to what they think is their priority. Thus going out of the more biomedical model and going to a broader scope, including mental, sexual health, social health. Well, thank you for your attention. I didn't look to the clock, thus if there is some room of questions, I'm happy to answer.
Thank you very much, Axel. Can you hear me?
Yes.
Awesome. Does anyone have any questions for Axel about the survey results? No? Oh, we do have a question, Axel. I'm going to pass over the microphone just a second.
Good.
Hey, good day, Axel. Antonio here from Vancouver. Do you hear me?
Yes, yes.
I want to know, maybe I didn't see all the presentation, but I want to know, did you ask the participants how they feel their health is bad, is poor? Do you have
but
that?
One of the questions was, how do you score your health? And we put it in physical health, mental health, and sexual health. And there were much more people scoring poor, thus finding that their health was poor. In mental health, it was 12%. In sexual health, 24%. And for physical health, it was 5%. Thus the message is that, generally speaking, people are quite satisfactory with their physical health, but much less with their mental and sexual health.
And talking about stigma and discrimination.
Well, there were some questions about discrimination. And we asked, for example, what are the topics where they were discriminated? And one of the slides I show was about in seeking care, what you see here. Thank you, Kate. In seeking care, in their social life, in applying for insurance and applying for a loan. Thus, we have some answers there. Thus, it's not only in relations, but also in their way to get care and so on.
Okay, thank you.
Does this answer your question?
Thank you. Yes, very well. Thank you.
Thank you.
Any other questions for Axel? Yes, we have one here.
Afternoon, Axel. I'm trying to find out, well, I wasn't here for the start, but I'm trying to figure out if there were any questions as it relates to disclosure and when people try to seek healthcare outside of their regular treatment sites. I ask because I'm from a region, which is the Caribbean, and I'm from Jamaica. So there are some serious issues as it relates to disclosure for people living with HIV when they possibly visit a healthcare professional outside of their regular clinic that they go, in terms of wanting to disclose or not.
Yes. Well, we didn't ask specifically about disclosure, but what we asked was the kind of confidence they have with the general, with the healthcare professionals in general. And they are much more confident in the close, let's say, hospital environment with their hospital HIV physician. But when you ask outside the hospital, only 45% of persons living with HIV are discussing their HIV with their general physician, which is surprisingly for me, because the general physician has a big task in healthy life, in psychological help, etc. And there is also even that the score of mental health and sexual health is poor compared to physical health. There are only a few persons going to a psychologist or a social worker. It's not answering directly your question about disclosure. It's more about the confidence they have with different healthcare professionals.
Thank you, Axel. Anyone else have any questions? No? Okay. Thank you very, very much, Axel. We appreciate you joining us from your vacation.
No, thank you all, and good luck in Montreal.
Thank you. And we wish you were here.
Next time.
Bye.
Bye.